Let's talk about the private sector now. You are a key and a very established player in Kerala, a state which has one of the best health infrastructures in India when compared to others and one of the best healthcare services. You are also a key player now, becoming a key player in Delhi NCR region. You are a disruptor, giving a tough competition to the major established chain in this region. Now, what role in private sector? How do you think we can leverage technology for providing quality healthcare services to our patients?
Sure, thank you, Neetu. So just to update everybody, I am with Amrita Hospital, and we have opened up a new facility in Faridabad. The capacity is 2,600 bedded. We are not fully operationalized it, but yes, it is one of the largest facility in India. And we already have a hospital in Cochin, Amrita Hospital, that's been running for 25 years. So that was the background why Neetu mentioned that. So that being said, technology, as Mr. Agarwal also pointed out, is definitely the savior for us, right? We all can appreciate, understand, and we can see that technology is pretty much ubiquitous, right? Every single place, and so is healthcare as well. It's not, maybe it's a little late in the game, like financial services probably was adopting to technology much earlier. In healthcare, it was diagnostic. But going forward, we can see that the hospitals are utilizing technology at every sphere possible. For example, it could be a patient-facing application, right? So you talk about mobile apps for the patient. You can be a patient portal where you can not only see your reports. CoWIN is a great example, by the way, but each of the player, each of the hospital have their own app also, where patient can see their data. Also, it can be used to make appointment, it can be used to do teleconsultation, so on and so forth. So that is on the one side, which is a patient-facing application. Then at the back office side, it's more for, say, inventory management. It's a huge thing. If you're able to manage your inventory better with technology, definitely it results in a better patient service. So that is on the back office side, including billing systems. And then in the middle, which is not necessarily patient-facing, but more clinical. And that is where the focus is going towards, because India in general is lacking on that space. So you call it EMR, electronic medical record. We have seen that diagnostic lab, radiology, they have moved to technology much earlier, but now clinicians, be it nursing, be it doctors, physicians themselves, they're also adopting to that. And maybe COVID was a great reason for that. It was, a push, and also it broke the barrier. Earlier, there was this always doubt whether technology can, be used for, say, consulting. But yes, we have proven that. So now physicians, clinicians are definitely on board, and that is where the advent of EMR and the use of AI. So AI, as you just mentioned, is a very upcoming technology and very, very powerful. We all must have used ChatGPT some point or other, and it's just amazing what it can do. And only if we can adopt it rightly for the clinical side of things, it will be of great help. So be it pathology, be it radiology, there are very good use cases where AI is playing a great role. And going forward, it will only help and it will improve going forward. And then lastly, if we use the technology rightly, the cost also can be controlled, and that can be passed on to the patient. So not only are providing a better service, but also you're reducing the cost overall.
Now, okay, let's assume that we integrate technology in our healthcare systems. We also make these healthcare services available to our patients in Tier 2 and Tier 3 cities. Now, in a scenario when India does not have a proper data protection law, Mr. Praveen Bist, I would like to come to you on this. In a scenario when we don't have a data protection law, what hospitals can do in preventing cyber attacks, like we have recently seen done on AIMS, ICMR, so many pharmaceutical companies have also faced this problem. Now, what can we do to prevent cyber attacks and to keep intact the patient privacy and data security?
So, very good question. Just before that, if we don't have a good consolidation of data, then the the threat is very low because what will they do even if they get access to the data? There is hardly much there. That's on the lighter side. But yes, cyber security is a very important topic. As we move more and more digital, more and more transactions online, then obviously the chances that somebody is going to misuse it is also going to be equally there, right? So how do we kind of detect that threat? How do we respond to that threat is a very, very pertinent question here. And we all know आजकल TVs में सब जगह आता है OTP में share करिए, password make it strong and all that. So those are all the very, very basic problems that we can potentially face, which can be easily prevented. But then it's a basic 20-80 rule where 80% of the problem can be easily resolved. But it's those 20% which can be really devastating, right? It can actually harm the entire organization. So having said that, there are a lot of tools available in cyber security. Get into the too much details. We have, it's towards the end of the day, and I don't want to have a long spiel on technology. But there are products, but they're expensive. There are SIEM products, security information event management. There are SOAR, security orchestrated automation and response. So there are multiple of these systems that are available. But one, they're expensive. Second, you need expertise to even use the system. Even though with the AI, things are becoming easier because you need less resources and system machines are able to do what manually you would have done. But then still, there are resources that are required to implement these solutions. But going back to talking about integration.
If you like the video, do like, comment, share and subscribe.